I have heard about the vampire procedure. Does that type of cosmetic procedure help with rejuvenation of skin? I am interested in, now that I am in my 40s, what type of procedures I could use to give my skin a youthful look. I have used Botox before, but only on my forehead. Can I use Botox around eyes and face?
Thank you for your question. You're asking first about the vampire facelift procedure, and you're asking can it help rejuvenate your skin? In the additional part of your question, you also ask about Botox, that you've used it in your forehead, and can you use it around your eyes and face? And now that you're in your 40s, you are clearly exploring options to help maintain a youthful look. Well, I can certainly give you some guidance with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm a very active member of the Vampire Facelift network of physicians. I've been a resource for the media when periodically there's a question about the vampire facelift, and I've been featured in a few television shows and periodicals and newspapers. So I think that first it's important to understand what a vampire facelift is, because certainly terminology can be a little bit confusing. So to begin with, the concept of vampire facelift was developed by my friend and colleague, Dr. Runnels, who came up with this name that has been quite remarkable in terms of attention in the media. Essentially what he came up with was the combination of two things to help people look younger. One was restoration of volume. And in a way, the age 40 is kind of like the ideal sweet spot for this particular brand of treatment. And the reason is that he recommends the use of one syringe of an injectable filler, such as a hyaluronic acid filler like Restylane or Juvederm, placed strategically in various areas of the face to help add structure. And then the vampire part of this treatment is the use of your own blood, and using the concentration of your blood called platelet-rich plasma, or I should say separation of your blood called platelet-rich plasma. This is the part of the blood that's necessary for wound healing. Stimulates blood supply, new collagen. It's basically what you need whenever you get a cut. When you have this combination, it has a remarkable rejuvenating effect on the skin. When you inject PRP, or platelet-rich plasma, in the skin, we use it in our practice to improve wrinkles. We use it for discolorations. We use it for scar treatment, for acne scars. So for skin complexion, what we have seen is this beautiful glow to the skin due to this activity. Now, can PRP be combined with other treatments? Absolutely. Can it be combined with Botox? Definitely. Botox it's not by accident, it's the #1 non-surgical cosmetic procedure. It is the use of a neurotoxin which relaxes muscles. So we can use Botox for forehead lines, for crow's feet lines, for under eye, for the ridge under the smile lines, for the ridge under the margin of the eyelid, for bunny lines, for gummy smile, for drooping lips, for lip turning. I mean, on the face alone, there are so many opportunities to use Botox. So the idea, I think, is that when you are starting to explore options to help you look your best, I think that the options available to you are pretty significant. And the key is to find the right doctor that can guide you. I always tell my patients that who have been with me for many years is that basically I'm their primary care doctor for beauty. Although I'm a surgeon and I can do a lot of different things, in our practice we offer everything from skincare products to lasers, to microdermabrasion, microneedling, as well as minimally invasive procedures such as injectables like PRP and hyaluronic acid fillers to advanced surgical procedures. What is important is finding a doctor that you can trust, that will guide you along the way, and I can't stress enough the importance of looking natural. More and more people, unfortunately, are looking less natural these days and are getting undesirable attention because of how unnatural they look. And it's scaring a lot of people. In fact, when we see our patients these days, a lot of times people are saying, well, I want to improve my lips, but I don't want to look like such and such celebrity. So finding the right doctor who shares your aesthetic and has experience with treatments like the Vampire Facelift or PRP and other modalities, essentially it's about finding the right combination that works best for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.